Welcome to HQ2. My name's Dr. Roland Dilling, and as Adam said, I'm the Chief Medical Officer and the Director for AWS Public Sector Health. I am an academic interventional radiologist by background. In my current role, I have two kind of roles really. There's an externally facing role where I have the privilege of talking to our end users. So I'm the Chief Medical Officer of AWS, not Amazon.com Health Services. So the first thing is just to differentiate the two. So Amazon.com Health Services, things like One Medical, Amazon Pharmacy, PillPack, that kind of thing. AWS provides the infrastructure that supports all of those and global infrastructure for governments, health systems, big technology partners like GE and Philips. They are all platformed on AWS. And so we regard Amazon.com Health Services a bit like just another partner. So that's a bit of context. I'm also very pleased to first of all welcome you all here and thank you for being here. AWS is really proud to be partnering with CBTN and all of the work that you're doing to change the lives of patients and families in the US, but also around the world. And I think that global aspect of what you're all doing is really, really important. I'm also very pleased they shut the blinds because it's very difficult to compete with airplanes taking off. So thanks for that. As part of my clinical radiology practice, so I practice as an interventional radiologist doing cancer interventions. So I was a body interventionalist. I had a CT scanner in my operating theatre, putting needles into tumours to destroy them either through heat or cold. And as part of my practice, I actually had a paediatric practice working with paediatric patients who had sarcoma metastases. And so as part of our work with University College London and the Royal Marsden Hospital, we actually also collaborated with a lot of hospitals that are represented in health centres represented in this room today. So it's a pleasure. I feel like I'm coming home almost, working with you all today in this capacity. I lost count of the number of times as part of my clinical practice where I had patients that had complex problems working across multiple centres, often not just within the UK, but also internationally. They'd had different results, different scans that required multiple repeat, often invasive procedures. And this resulted in delayed diagnoses, repetitive investigations, and incredible amounts of frustration for families, care providers, and clinical staff as well, who couldn't do anything about it. They felt a bit kind of, hands are tied. And I think that's what you're just describing with the CD-ROMs on the desk. And I think that is one of the things that I'd love us to be able to solve together as a group going forward. Because it really is a mixing of technology, clinical expertise with an exceptional patient focus. And I think that is the power of CB10 and what you're doing together. So fast forward from my clinical practice now into AWS, and I had the privilege, as I said, of working with national governments and research organisations around the world. I had the privilege of being in Delaware last week at the Archmere Academy, where I had the opportunity to be part of the Quad Cancer Moonshot launch with President Biden and also the Prime Ministers of India, Japan, and Australia. And it was to look at cancer diagnosis, treatment, and prevention in the Indo-Pacific region. And it was a really honour to be able to spend time with this group in a small group setting, talking about the things that mattered to them most. And cancer treatment and prevention was high up on the agenda. It was held in the Archmere Academy in Delaware, which was the alma mater of both President Biden and our very own Dr. Jay Storm, who's the chair of the division of neurosurgery. And I was delighted to hear that you're hosting events at the Archmere Academy as well this year. So that's absolutely fantastic. Yesterday, I gave the opening remarks at our Gov2Gov meeting in downtown and introduced Dr. Mickey Tripathi, who's the new Assistant Secretary for the Technology Policy in HHS and the HHS Chief AI Officer. And Mickey's deputy is going to be here tomorrow talking in his stead, because unfortunately he couldn't be here. So again, we're very fortunate to work with a lot of the administration's senior leaders on these topics. And so it really has been a real, it's been incredible to see the focus of both the federal government and research networks such as this on paediatric patients in particular, and as part of the Cancer Moonshot Project. And the Cancer Moonshot Project was originally run by President Obama, and then Cancer Moonshot 2 was ignited by President Biden, and this has been a real focus of what's been going on. And we've been very fortunate to be supporting CBTN, CHOP, the Cancer Moonshot, DPG1, Link, and so many other initiatives basically focused on establishing a broader pediatric data sharing infrastructure. Because I think it's through sharing data, everyone becomes smarter. And at Amazon, we like to go fast. And this is one area in particular where speed is key. Where if the average child diagnosed with DIPG only has 9.5 months to live, and as these tumors evolve rapidly, having refreshed data to guide therapies, as was so eloquently described, it really just is invaluable to decision-making by clinicians, researchers, and biopharma partners who are coming up with new discoveries. And motivated by CBTN, Dr. Resnick, Dr. Storm, patient advocates, such as you, this summer, AWS made a $10 million initiative to AI for pediatric health. And we had the honor of being called out in the White House fact sheet to that end. And as part of that $10 million initiative, there are actually three $1 million unrestricted grants to Children's National Hospital, Nationwide Children's, and to CHOP and CBTN. And this commitment really is intended to help you harness the power of the cloud and AI for related efforts around pediatric brain tumor research. As we just mentioned, AWS isn't the only organization impressed by the trailblazing position that CBTN has held in this area. And it's absolutely fantastic that ARPA-H has recognized you all and your ability to move with speed. And I think this $10 million infusion from ARPA-H for this R3 project, which I think is a great named project, so it's real time, real world, real impact. And I think they're all three things that are really, really important. And I'm also proud to see that AWS and some of our partners here today are listed as technology advocates, and encourage even more technology partners to join as we move forward with more speed. AWS is helping expand the circle. So what we want to do is work with CBTN to make sure that it's not just the current partners you're working with that are able to deliver for our patients and end users. It's also broadening that circle into the pharma space. And so again, it's a great privilege to work with groups like AstraZeneca, Day One, Flywheel, to make sure that the data is available and being used. And again, we want to bring the technology to bear, things like Amazon Clean Rooms, Amazon Health Lake. You'll hear about some of these managed services that we offer as part of some of the workshops that have been going on over the next 3 days. And so I can't impress upon you the pace of change in the technology is absolutely staggering. And so it's absolutely fantastic to bring clinical leaders, bioinformaticians, together with technical experts to understand where the overlaps are and how we can drive innovation forward. Because just having data isn't enough. You have to be able to extract insights, and you need to be able to work with now generative AI to do this. I mean, that's just another tool in the toolbox. And so, as you know, hands up who's used generative AI in the form of an app on their phone, probably. Yeah, I mean, this is now ubiquitous technology. And AWS has been democratizing access to technology for almost 20 years. So we've been democratizing access to computing power, infrastructure, networking, and now we want to democratize access to generative AI. Because we don't believe there'll be one foundation model to rule them all in the future. There'll be hundreds, if not thousands, and they'll be tailored for specific uses. And so how we can work with the technology partners to have specific uses for your needs will be really critical. I know many clinicians in the room have concerns around AI, and we want to make sure that we want to have your voice in that discussion. We're advocates of responsible AI. We subscribe to the White House voluntary engagement around responsible AI, and also have been part of CHAI, which is the group which comes together to talk about responsible AI, only in the last few months. So again, we've got a very big focus on this, but we need to involve stakeholders. That's absolutely key. And also, this is an aid to clinical decision making, not a replacement of it. I have to really, really stress that. And so education and training is a thing that then we'll need in order to leverage this technology and make it accessible to all. And so that's why AWS recently announced this AI Ready program, which is a commitment to provide free AI training skills to 2 million people around the world globally for free by 2025. And this augments our initiative already to train 29 million people in cloud skills for free by 2025. We've actually already surpassed that. We're actually at 31 million people trained so far. And there are lots of things you'll be able to see in the next 3 days, such as AWS Skills Builder and AWS Educate, and these are tools that you can all use online to drive things forward. And so now, we're seeing really interesting initiatives around how to learn and how to do this better. So one of the tools that you'll be using is a working backwards technique. So hands up, who knows what working backwards is? I hope everyone who's Amazonian in the audience put their hands up. That's good. If you don't know it, it's a technique that we use in Amazon to innovate. And so working backwards starts with the end in mind. And you have to say, what is the thing that we're looking at in the future in an unconstrained environment? So without all of the normal things that hamper every clinician and every patient and every care provider, taking all those away, what does good look like at the end? And you start with that in mind and you then work backwards. And so what we do is then write a press release for what it is that's going to be announced in 18 months, a year, 6 months, how ambitious you want to be. And with that press release also comes a list of PR and frequently asked questions. So not only is there a press release today, we want to announce that this is happening, a list of frequently asked questions which addresses the problems that you may envisage. And it's a really powerful tool to drill down on questions and the problems that arise so that everyone has a common and shared vision. And often we can write a storyboard behind that as well. So what I hope is that we can see these being written over the next 3 days and we can get your best ideas down on paper, choose them and push them through to completion. So how can we work backwards to reimagine the future for pediatric patients who have brain tumours? Because the point is that we are facing exponential problems. We have too few care providers, we have too many patients, there's too much data to handle and to pass and to understand. Training more people isn't in itself going to be enough. We have to bring exponential technology to bear on these problems. And I think together we have this capability to come up with these solutions that will truly be exponential. I'm really excited to see some of the ideas that you will all produce as a result of this summit. Personally, I'd love to understand how we can decrease the price and the cost of clinical trials while increasing access to them and speed of delivery. That's a real focus of mine, but I'd love to see yours as well. As one example, I'll just leave you with this as an example of what we did. So this is an example we used with Genomics England. They had a problem. And their problem is they're trying to comb all of the published literature, looking for studies which associate genes with clinical outcomes. And in this case, they were looking for gene association with learning and developmental delay in children. And when faced with the world's largest data source of the public internet and PubMed, they've got a team of biocurators that just publish and read and have to filter the evidence and work out what's what and what's related to which. And it's an incredibly laborious task. They take months combing through the data, even trying to address one question. So we worked with them to use the power of generative AI and our Bedrock tool and using Anthropic's Claude model. We trained the model using the published literature. Essentially, we created a prompt using all of the literature available and said, look, using all of this literature, come up with gene associations. And using this technique, we worked with them for about 12 weeks worth of work. They were able to come up with a solution which identified 20 new gene associations linked to developmental delay, which were previously not known, which are now targets for gene therapy. So I hope that illustrates the transformative power of this platform. And it also means that you can take this thing that's been built and spin it up against another question in a matter of days. So this is where this power of both transformative technology and collaboration really come in. To help with this, we've announced the AWS Generative AI Impact Initiative. It's a 2-year-long global initiative, $50 million worth of credits to help public sector organizations globally to accelerate generative AI adoption. Please use it. This is for you. We want you to use it. And so that's why I want to leave you with this ask. So whether you're here in the room or one of the hundreds watching online, let's help the children who need it most with the latest technology and the tools available today. All of you have an opportunity to be owners. So Ownership is one of the leadership principles in Amazon. I'd love all of you to leave with that feeling inside you that you own a solution to this problem. We want to understand everyone's input into this because we want to democratize access to everything. And also, please don't limit this to the children's pediatric community or the community of those who have brain tumors. This is all transferable. We're starting here because we know it, but it has the ability to scale and to have global impact across healthcare. So let's get started. Thank you so much.